Stress, anxiety, sleepless nights, heart palpitations. These might sound like the usual symptoms of a rough week, but what if I told you that they could also be setting the stage for something much more serious? Like, what if stress could be the silent culprit behind worsening blood sugar levels, pre-diabetes, and even diabetes? In this video today, we're diving into the hidden connections between stress and blood sugar regulation. We discuss stressors with every patient who come through our clinic, and this means external behavioral psychological stressors as well as environmental stressors and what we call physiological stressors. It's a vital conversation that explains the interconnectedness of our bodies and highlights the need for a holistic understanding of our health and well-being. I'm Dr. Derek, and I'm speaking to you from Revive Naturopathic Medicine. We're a team of naturopathic doctors, and our mission is to educate and empower others with the contextual and practical and nuanced information that's sorely missed in a lot of health conversations online and in the office these days. So today, we're going to explain 5 of the ways that stress tends to negatively impact our blood sugar regulation. As well as I'm going to share with you 2 ways we can evaluate our stress levels. And as a bonus, if you stick around to the end, we'll also share a free trial for a favorite app that we use at our clinic that's been very helpful in my life and helping our patients navigate their stress response. Obviously, it's not fun being stressed out, and most of us aren't actively, trying to be stressed, but the experience happens to all of us. Regardless of how easygoing we might be, life will always throw its curveballs. But what's happening biochemically behind the scenes when we're stressed? The answer is a lot. We're going to go into a couple dynamics that I think are kind of pertinent and relatively easy to understand. When we're stressed, our body releases stress hormones. A couple of ones you might be familiar with are cortisol from our adrenal glands and adrenaline. And these prepare us for a fight or flight type response. Or, a more gentler way of saying that is it helps us rise to the occasion, right? These hormones prepare us for action. And as such, they help our body mobilize fuel. They actually tell our liver to kind of release stored glucose into our bloodstream to provide us with a quick source of energy. And of course, this will cause our blood sugar to elevate. In a true life or death situation, this is exactly the response that we want, right? We need fuel at the ready to go. But really in this day and age, most of our stressors are a lot more chronic in nature. And with that, they're not really life or death situations. And if we are chronically stressed and we are constantly having this influence over our physiology, you can see how it can really interfere with good, stable blood sugar levels. I personally was told that I was pre-diabetic to this exact same reason, so I want to share a story with you. We're going to rewind. I was back in med school at the time. And I was seeing a naturopathic doctor, and I had my regular appointment. I decided I was going to skateboard to the clinic. And for anyone who's lived in Portland, I was skateboarding over the Ross Island Bridge, and that bridge has 1 lane of traffic one way, 1 lane the other way, and a very small sidewalk. And I was skateboarding over the sidewalk. Not a problem, but of course I caught a rock on my skateboard wheel, and it stopped my board, and I kept going forward. And I tumbled, luckily, onto the sidewalk and caught myself, but my board also flipped into traffic and then caused rush hour 8 a.m. traffic on the Ross Island Bridge to halt to a stop. Needless to say, the experience was a little jarring for me at 8 in the morning. I got my heart rate up for sure, but I didn't really have an option. I picked up my board and I kept going to the clinic to get my blood draw. So later that week, I followed up with my doc, and he surprised me with some results. He's like, Derek, you are pre-diabetic. And I looked at him, I was like, no, there's no way, there's not a chance. I eat really clean. I exercise. It's like, what's up? He's like, well, it's like, has anything stressful happened to you? Maybe the day before you got your blood draw? And I said, well, I recounted the event that happened on the Ross Island Bridge. And he explained, oh, well, next time you go to get your blood drawn, try not to die on the way there. And the point of it is that stressful event caused a bunch of glucose to dump into my bloodstream. So when I went to the lab to get my blood draw, my fasting glucose was incredibly elevated because that stress response mobilized a bunch of fuel for me to survive and elevated my blood glucose. Stress equals blood sugar elevation, right? But our stress response doesn't really know the difference between a life or death event, where additional fuel might be necessary, or, anxiety from a meeting or bad traffic on your commute to work. So this is where we have to think about how we have an adaptive response, and sometimes the world we live in is not really made for that kind of response. And in fact, chronic stress really worsens what's called insulin resistance. And if you haven't heard of insulin, it's an important player in blood sugar regulation, and I'll break this down quickly for you. When we eat carbohydrates, crackers, rice, fill in the blank, right? Fruit, we break this down into simple sugar molecules like glucose. And we absorb these glucose molecules from the gut into the bloodstream. But of course, we don't really want lots of blood sugar in the bloodstream, right? It's really just the highway for glucose to travel through. We want glucose in our cells, right? In particularly things like our muscle, right? And our liver and our kidneys and our nerves. Well, to get glucose into the cell, it must pass through a gate. And the key for that gate is insulin. And so insulin resistance is a situation where that key doesn't work very well, and it causes a backup of glucose in the bloodstream. And it takes more and more and more insulin kind of just to get the job done. So why is this bad? Well, insulin, it's important, right? Obviously we need it to allow glucose to be utilized. But it's also a hormone that gives our body a metabolic message to store energy as fat, which of course can then lead to weight gain. So if you think about a chronic stressor or chronic stressful situations, this is going to very much increase insulin resistance in the body, sets the stage for elevated blood glucose levels, high insulin levels, pre-diabetes, diabetes, and weight gain, which is why a lot of times all those things come together. High stress can also lead to emotional eating, right? We've all been there, right? And nobody emotionally eats a salad. Sorry, nobody does that. We choose ice cream and cookies and chips and things that are sugary, carbohydrate-laden foods. And part of that is because we know subconsciously, like, that's fast energy, right? We can get that in very quickly and utilize that. But of course, these are foods that are laden with glucose, and they cause huge blood sugar spikes. Stress can also lead to overeating, right? Or in some people, even skipping meals, and then binging, later on in the day, which can further destabilize blood sugar. Of course, we've also had sleepless nights associated with stress, and these two things go hand in hand. And whether it's worry or grief or a growing to-do list, even things like PTSD or just like a brain that just won't shut up, right? Disrupted sleep is common in a high stress life, and we know good sleep is important. You can feel it when you get it, right? But few of us really understand how pervasive the effects of poor sleep are. In fact, we made a video specifically around how sleep interferes, or how poor sleep really interferes with blood sugar regulation. I suggest you check that out. If you're a reader and you need a good read, the book Why We Sleep by Matthew Walker is a great book to help understand why sleep is so critical to our functioning. goes in depth into all of its kind of nuanced connections to our physiology. And what you'll learn is that even one bad night of sleep can influence insulin resistance the next day and destabilize blood sugar. It also impacts things like hunger and food choices. Like, we are more likely to make poor food choices in a day after we have a bad night's sleep. This is in fact a trend we look for in our patients when they're using continuous glucose monitors. We always ask them to track sleep quality when they're wearing a CGM, whether it's a journal or a wearable. And we like to be able to correlate, well, how are your sleeps on these nights? Did they make any sort of influence on blood sugar the next day? And or vice versa, did this dinner and subsequent glucose stabilization correlate with a bad night's sleep? And in fact, like I said, we did a video specifically on this, and the link is going to be below. I would say the last piece that we want to hit on when it comes to chronic stress and blood sugar regulation is that, when we're stressed, we get kind of lazy or overwhelmed. Right? We're too overwhelmed to exercise or to plan our day correctly, and it's hard to make time for the self-care. What I often say is when we're too stressed, it's almost like we have blinders on, and we can't really see anything more than putting one foot in front of the next. And I get it. I've been through medical school. Like I've experienced stressful and sleep deprived days, and sometimes you're just trying to survive. But it highlights another variable that helps us regulate blood sugar, is that when we lose that self-care and we lose those habits during our day, things like exercise, right, that allow us to be active, we are missing out on a valuable part of blood sugar regulation, right? Like, our muscles utilize glucose, right? Glucose is fuel, and we want to be fuel efficient vessels. And so given that, using our muscles, strength training, cardiovascular training, high intensity work, have incredibly important benefits for blood sugar regulation and insulin sensitivity. So when we become stressed and overwhelmed and those pieces start to slide off the table, it can be a real big problem. And that doesn't even speak about how exercise is often a really useful just stress reliever. Ever been upset and pissed off and then gone and punched a punching bag? It feels very nice. So, but these things are really hard to do when we're marinating in stress all the time. So I don't share all this to kind of bum you out, but because there's actionable steps for all of this. But it's important to understand the nuanced connections that stress has and how it's a big player when it comes to blood sugar regulation. And it can kind of highlight how utilizing a continuous glucose monitor has a unique place for us to be able to see this activity in real time throughout the day. I'll share another story with you. I recall consulting with a patient on her CGM findings, and we were going through it day by day, and I noticed a huge spike in one of the afternoons. So I asked her, I was like, what did you eat? And I mean a huge spike. The response was, I ate nothing. I was on the phone with my insurance company. And I could hardly believe it. It blew my mind. I mean, it might have well have been 4 donuts, and it made me think, if this is happening routinely enough, as it was in this case, right, just think about the metabolic impact that it's having on this person's blood sugar regulation, making them far more prone to potentially developing diabetes. And of course, diabetes is also a risk factor for heart disease. And it was a really big eye-opener on the impacts of stress. While continuous glucose monitors don't look at stress hormone, they can be used to some degree to kind of see the impacts of stress hormone on our body. That said, there are more direct assessments of stress hormone as well. The most common evaluation we do at our clinic is a stress hormone test called the Dutch adrenal test. It evaluates cortisol in the urine multiple times throughout the day. Cortisol has a normal ebb and flow throughout the day. In the morning, it's supposed to be nice and high because we're trying to rise to the occasion for the day, do what we need to do, tapers off in the afternoon. It should be nice and low in the evening time. And the way this test works is that we can see that curve play out. And you have to remember, stress hormones aren't bad. We need them, right? They help us rise to the occasion, and we should have this normal ebb and flow. But when that curve looks dysfunctional, it's maybe not high enough in the morning, and that can show up as fatigue, or it's way too high in the evening time, and that can, correlate with disrupted sleep. This test can kind of help us understand, do we have a healthy pattern or do we not? Another way to evaluate our stress response is through heart rate variability. And this is a testing metric that's built into a lot of wearable devices. It's built into Oura rings like this. It's built into Apple Watches and Whoops and Garmin devices, as well as others have abilities to track baseline heart rate variability. It's also called HRV for short. And HRV is a measure of how much time there is between each of your heartbeats. Okay, so our heart doesn't beat like a metronome. There's subtle differences in when those heartbeats come. And so when we're relaxed and healthy, our heart beats at a slightly different pace every time, which means you have a high variability of your heart rate. That's a good thing. But when we're stressed, our heart beats more regularly, and the variability between our heartbeats go down. So a lower HRV can be a sign that our body is under stress or not handling stress well. It's like a measure to determine how calm or stressed your body is. And it's really easy to see this show up in real time if you look at your HRV. If you are fighting a virus or sick, it will drop down pretty significantly because our body is under stress when that's happening. And then as we get over it, it will come back to a baseline. So I want people to know more about their stress response, and I want them to have more tools to help navigate it. So if you're struggling with blood sugar regulation, then looking at your stress response is a must. Start with tracking your HRV. Get a entry-level wearable that can help you understand that. Consider a cortisol evaluation, and you can visit a link below in the description for direct access to the Dutch adrenal test. And if you know that your blood sugar may be awry, maybe a continuous glucose monitor is for you. And if you're interested in that, we've designed a Fuel Better program, which is based around 30 days of continuous glucose monitoring. And includes personalized insights from one of our naturopathic doctors. And oftentimes we'll even talk about more nuanced evaluations that might be relevant in your case. And that's why we like to have these one-on-one discussions to really make it personal to you. That said, CGMs are pretty easy to come by these days. You can go online and look for some, and you can even ask your doctor. A lot more are open-minded now to utilizing these as tools. If you're lucky enough to have already experienced a CGM or you currently wear one, consider watching our video on why you may be not getting the most out of it, and the associated CGM experiments ebook. You can see the link below in the description. That video was born out of how we think it is most kind of ideal to use a CGM. These are learning devices, and we want to understand and maximize what they can tell us. So you stuck around to the end. Thank you. And as promised, I'm going to share an actionable step that's helped me and my patients gain perspective on and influence over our stress responses. And it is an app. It's an app on the phone called Waking Up, and it's designed by a neuroscientist and philosopher named Sam Harris. Thank you for this, Sam. It's an app based around a meditation course, but it's also rich with incredible content. Short lectures, interesting conversations with people in the meditation and kind of stress management space. some interesting perspectives on meditation and consciousness and life philosophies and stress. And I've found it incredibly valuable personally, and a lot of my patients have really liked it as well. If you download our Stress-Free and 1-2-3 ebook, you'll find a link in there for a free month trial of the Waking Up app, as well as more information on the Dutch adrenal test and 3 of our favorite stress support supplements. So please share your thoughts with us in the comments below, struggles or successes with stress, and let us know if you like this content so we can continue to make relevant videos to support your health education. So I'm Dr. Derek, and thanks for watching.